Now, the CDC Vaccine Advisory Committee is meeting today in Metro Atlanta to discuss and vote on new recommendations for Americans. 11 Live's Marissa Sarback joining us live with the key takeaways from day one of these 2 days of meetings. Marissa, what do they mean for us here and the families out there with the vaccines? What are we learning today?
Oh, these recommendations, if they go into effect, really could have an impact on not just Georgians, but Americans all across the country. We do know that discussion has finished up for the day, but at this point, the committee is taking public comment before they are expected to vote on any potential policy changes. We're expecting that vote within the hour.
We have a short update.
Thursday at the CDC offices in Chamblee, the Advisory Committee on Immunization Practices discussed whether to change guidance on the MMRV vaccine. The question, should children get one combined shot for measles, mumps, rubella, and chickenpox, or separate doses for the first round because of a slightly higher risk of seizures when given as one vaccine?
Regarding an MMRV at 4 to 6 years of age is that, and I think you said this, that more than 95% of febrile seizures occur before 4 years of age.
Dr. Katrina Kretzinger, who retired from the CDC in 2023, says this is actually very similar to what most doctors are doing now.
The only change is that the CDC would no longer recommend using that 4-part vaccine in the 12 to 15 month age for the first dose, whereas now providers can choose to use the 4-part or they can choose to separate it out. And right now, 85% of providers and parents choose to already have it separated.
The advisory committee is also discussing changing the recommendation of the hepatitis B vaccine for all children to only recommending it for children whose mothers are hepatitis B positive and are at risk of passing along the disease during birth. The new CDC advisory committee is made up of 12 doctors who started serving under HHS Secretary Robert Kennedy.
A lot of the career, highly qualified scientists at CDC have been fired, as I think everybody knows at this point.
Sarah Boehm, former CDC employee who was let go earlier this year, argues any changes in recommendations would impact Americans in the form of their health insurance coverages, as insurance companies follow the guidance of the CDC. The doctors in the advisory committee today told us that actually the FDA will have the final say and final impact on any insurance coverages and what they do cover and what they don't cover. Now, as for policy recommendations, they say all of that will have to go through the CDC director and approved before it's officially put into effect. Reporting live at Roybal campus tonight, Marissa Sarback, 11 Alive News.
Marissa, thank you so much for bringing that to us and really staying on top of this story. Of course, these are recommendations. They are not mandates from the CDC. Medical professionals and their patients, they can still make their own decisions here. And in day 2, we are expected to hear their discussion and their vote on the COVID-19 vaccine recommendation.